Hello, this is Sheshachalam from Astrology Mysore, and today we are seeing a very serious topic and we are discussing about it. Let us learn how did this happen to the native. This is about a prostate cancer. This is a case study of a real chart. So in this chart, we have a male aged about 60 to 70 years and is having this kind of a placement. So we have Saturn and Ketu in the second house. We have the ascendant at Sagittarius, Jupiter in the third house, Rahu and Mars in the eighth house, which gives rise to Deha Kashta Yoga with related to Rahu and Mars. See, Deha Kashta Yoga's definition is that when the ascendant goes to the eighth house, it gives it. But that is for the native throughout the life. But this is temporary and keeps coming when that particular planet gets excited or it gets initiated. So let us see that. So we have a retro Venus in the 11th house, Sun and Mercury very closely posited. That is within some degrees, because in the D9 chart, I have not put the D9 chart, I have put the North Indian chart, the same thing here. So Sun and Mercury are within 1 degree from each other, so 1.5 degrees from each other. So in the D9 chart, they are sitting next to each other. So that is a combust Mercury, and we have Moon in the 12th house. So with this combination, we need to see why did the prostate cancer happen to this native and when it actually happened. So the setting of the problem happened within the dasha of Rahu. So the Rahu dasha, Jupiter is running from 18th of December 2025 to 13th of May 2028. So this is the time period in which the problem was felt and detected. So within this period, if we go into the Antardasha period, we can see that within this, that is Rahu, Jupiter and Jupiter, will start on 19th of December 2025. That is 18th only, 18th of December 2025, and will be there till 14th of April 2026. So this is the period crucially in which the problem was felt. After that, anyway, the native will have gone to the hospital, gone through some, FNAC or some, I don't know what they do. They take a biopsy and they take some sample, they do the biopsy and they came back. And then got a feedback after 14th of April. So I got the feedback on somewhere on 23rd or 24th of April, I think. So I got the feedback from the native telling that yes, it has been confirmed that the native is going through a prostate cancer, and this detection happened in Rahu, Jupiter. It happened in Rahu, Jupiter Antardasha, Saturn Pratyantardasha. This particular thing is between 14th of April 2026 and till 1st of September 2026. So the person is now going through the treatment, the hospitalization treatment is all going on. But why did this particular thing happen? So before why did it happen, I will also say that we need to not only see the third level of the dasha, we also need to see the transit. So at this particular period of time, we have the transit of Saturn over Pisces. We have Rahu here. This is the current transit also. And Jupiter was retrograde at the time of Jan 2026. And we had Ketu here in the Ninth house. So we can understand here that the Lagna Lord has gone to the 7th house in the transit, okay, and it is retrograde, giving rise to a tough period of time. Saturn in the 4th house, not that great, and we are running through a very tough dasha of Rahu. So when Rahu is running in the 8th house, it gives rise to Deha Kasta Yoga. Just can you give me the D9 position of Rahu? So D9 position of Rahu is in Kanya. This is the D9 position of Rahu. And this is the D9 position of Ketu. This is D9. So this particular position of Rahu Dasha and Jupiter Antardasha, not Rahu did not give any problem. Maybe it was slowly setting, but it actually happened in the Jupiter, and the Jupiter one, which is the one which is very to be understood, that it is not that easily posited. Why? Because Jupiter and Rahu are in the 6-8 position from each other. From Jupiter, Rahu is in the 6th, and from Rahu, Jupiter is in the 8th. 6-8 position is also bad. That is the Triksthana position. We call it as Sashtashtaka dosha. So there is Deha Kasta Yoga temporarily running because it is Rahu sitting in the 8th house, and the Dasha Mahadasha, that is the period of Rahu, is running, and within that the Antardasha of Jupiter is running. And whenever the Mahadasha Lord and the Antardasha Lord are sitting in 6-8 from each other, that shows that there is some difficulty in the that particular period for the native. And Rahu and Jupiter both are very clearly for all those organs like kidney, processing organs, prostate, kidney, even the large intestine, the rectum, the colon, the abdominal part is totally highlighted because of this particular combination of Jupiter and Rahu. Some people get early diabetes, some people get insulin problems, they get into some pancreatic problems. So I have many charts with me with even pancreatic cancer also, but I will come with those charts later on. But here we should understand that when you are doing the delineation of a chart, when you are trying to understand a chart, the 8th transit of Jupiter, retro 7th transit of Jupiter, the Antardasha of Jupiter from the Mahadasha Lord, which is sitting in 6-8, and the Mahadasha Lord, that is the major period of Rahu happening in the 8th house. This is not a good period for the person. So this is the recovery period, and let us see when will this person recover. So he is going through all the required medical treatment. He will be going through the I think the immediate operations are happening. It is part of it is removed. So many things are happening here. Yeah. For that till September, this particular period of Jupiter, Saturn, that is Rahu Mahadasha, Jupiter Antardasha, Saturn Pratyantardasha. This is major period, sub period, and sub period. Until this is finished, he will be going through a lot of pain and treatment. And once that is done, he will be going through the other period of Mercury. Once the Mercury comes, the recovery will be fast. But still, I have my own doubts here because Mercury is the 7th Lord, sitting in the 12th house, not such a great position. But luckily, from Jupiter, it is in the 10th, and from Rahu, it's in the 5th. So, keeping in mind that the relative positions from the Dasha Natha, that is the major Dasha Lord. Jupiter transiting the 8th house. Exactly. So I was coming to the transit because the future also comes there, because June 2nd, Jupiter will be entering here, and I'll be doing a lengthy video on Jupiter transit into Cancer for all the ascendants, that is ascendants and the moon signs. I'll be doing it in 2 3 days from now. It will be coming on time. But here, as my wife said, this is the Jupiter transit, Mercury here. It might be a little difficult for this person to take it. So let's all pray that this person fully recovers, because this particular transit of Jupiter, the transiting Jupiter along with Rahu in the eighth house from the ascendant, is not a comfortable position. So maybe he will have to go through, further medication and further consultations with doctors. But let's hope, there is age. Let him live well. God bless.